mute and I'll give you the go ahead. All right, we're live.
Oh my goodness gracious me, where did we go? Okay, let's get this party started. No, hello. Good afternoon, everyone who's joining us here on the screen and everyone who is joining us via YouTube. We're glad that you could be with us. It's been a while since we've had a town hall, and so much has changed since then. It's time for us to do some talking. The last time we gathered and we had a town hall, vaccines were becoming more readily available, and we all were talking about being hopeful and seeing the light at the end of the tunnel. Now our EOC is winding down, and sadly, we lost our former county administrator, Jason Molina, who you're used to seeing on this call as well. But we have a new interim county administrator in Lisa Holmes, who's joining us today, and you'll hear from her later. And of course, Monday was the unofficial start of summer. So here we go. I hope everybody had a chance to do some cooking out and enjoy the good weather. It wasn't too bad. A lot has changed. Frank, Amy, Lisa, thank you all for being here. You know, Frank and Amy, they're veterans on this call. So we're glad that you could be here. And tonight we're gonna talk about some of the changes in a little more detail, put Frank and Amy on the hot seat and a little bit of Lisa as well, to share with you, our community, what are all the things that have been going on, some good, some not so good, but the fact that we continue to be hopeful. So we're not going to take up too much more time. We're going to jump right in with the questions. Okay, you ready? So let's, Frank, I think most of what I have to ask are probably directed at you, but Amy, you can also jump in. What is our current stance on COVID-19 prevalence in our community? It's a two-part question. And what is the current level risk for vaccinated people like me?
Sure. I think right now we're pretty optimistic about where our disease levels are. We're hovering around 30 active cases. We're seeing some days with 1 or 2, and then other days where we might have 8 or 10. So that's good news. I don't think 0 is really a realistic number. I think we're going to continue to see cases as long as we're doing testing the way that we are, and we're still working towards getting more people vaccinated. So generally speaking, we're in a good place from a disease level perspective. What was the second question, Leslie? I'm sorry.
The second is, what is the current level, risk level for people who are vaccinated?
Sure. Well, if you're fully vaccinated, the risk is relatively low. The guidance has shifted, and you can go about doing activities pretty much the same way you were pre-pandemic. And because our disease incidents are low, even if there was a breakthrough case, which is when somebody who is fully vaccinated does become positive, it's very unlikely to happen. And what we found is even in those cases, if there's any symptoms at all, they're extremely mild. So for those that are fully vaccinated, I think risk is relatively low.
Thank you. So that's good news. That is very good news. My other question, are variants widely present in our local COVID-19 cases? We keep hearing more and more about different variants. What does it look like for our cases?
Yeah, so we're fortunate that Cornell, in partnership with Cougar Health Systems, has been doing a research project which has allowed them to do variant genomic sequencing on all of our positive test results, as long as there's enough sample matter there to be tested. And so we have a good idea of what our variant picture looks like. And based on that research, up to about 3 or 4 weeks ago, all of the positive results in 2021 had been attempted to be tested. Most of them were. There were some that couldn't be, but amongst those that were, 90% of them were variants. So we are seeing here what we're seeing across the country, that variants are the predominant strain that people are being exposed to. Among that 90%, about 50% were the B.1.1.7, which is more commonly known as the UK variant, and 40% of those were the B.1.1.256, I think it is, which is the New York City variant. So predominantly seeing variants. Amongst those, it's the UK and New York City variants, which we would expect because those are the most common in our region and state. And really that just goes to the reason we need everybody to get vaccinated as soon as possible. That's what herd immunity is about, is stopping the disease from spreading from person to person and giving it that opportunity to continue to mutate and vary and potentially create a strain that is more virulent, more contagious, or really worst case scenario, immune to the vaccine.
Frank, thank you. You know, you learn something new. I learn something new every time I get on this call. I'd heard about the UK variant. I'd heard about the India variant. I've heard about the South African variant. This is the first time I'm hearing about the New York City variant, which is strange because I think I've been hearing about all of them. So thank you for sharing that. I didn't know that was out there as well. I'm gonna jump to this question because I think this you answered some of this with that response, but is there any more detail you can provide to the positive cases? Are most of them the variants? Where are they coming from? Are they this is multi-portion connected to gatherings, clusters, unknown spread? Anything you can share about the cases that we have?
Yeah, so as I said, most of them are variants. I should also point out about the variant testing. It takes weeks to get those results back. So it's not something that we're learning in the moment about each individual case. It's not diagnostic in that the patient isn't necessarily informed of the variant. And it doesn't change how either the healthcare system or the public health system reacts to that positive case. It really is a public health tool to understand how the disease is evolving. So just wanted to point that out. As far as what's been happening with the cases, we had a couple of small clusters, one related to a residential living setting, one related to a religious gathering that created some cases about 3 or 4 weeks ago. I think we saw a little bit of a bump when we'd been seeing single digits, and it might have jumped to higher teens and maybe up to 20. Those were the big blips that we saw. Generally speaking, the case numbers are really low, right? You're seeing 1 or 2 or 3 cases a day. So there isn't a lot of connectivity. We are still consistently seeing household exposures. So generally, if somebody in the home becomes positive and there are other normally unvaccinated individuals in the home, they're becoming positive just because of the close contact that exists there. But beyond that residential setting and the religious gathering, there really isn't anything of note to point out other than those household exposures.
Okay, thank you. So given the low number of positive cases, it sort of kind of almost indicates a slowing down of COVID testing. Is that the case? Is testing slowing down? And what does that do to impact our knowledge of the actual disease prevalence if we're slowing down testing? And then I have a second part to that question.
Yeah, so testing has slowed down a little bit. Obviously, a large part of our testing was related to Cornell. When the students were in session, they were obviously doing a large amount of testing there. And as students have now mostly departed the area, that those testing numbers will reduce. But we've also seen reductions at the mall and in other testing locations. And there's a couple of things that kind of play into that. One is, people aren't sick. We're not seeing folks with symptoms that are seeking out testing. We haven't had large exposures that have really resulted in people needing to get tested because of that. And more people are getting vaccinated. Once you're fully vaccinated, we really don't suggest you get tested unless you're symptomatic, right? So with having so many people that are fully vaccinated at this point, we would only expect that testing would begin to be reduced.
Well, that's awesome. We want more people to be vaccinated. When we did our 50,000 vaccination event, we were so excited about that. You know, our challenge to our community was, let's get up to 75 in a couple of weeks. And now we're like, can we get to 90, 100 pretty soon? So we want people to get vaccinated. We understand, and certainly we want to respect the people who, for whatever reason, aren't getting vaccinated. We certainly respect that choice. We don't want anybody to feel bullied. But if you are so inclined, we really do encourage you to go ahead and get vaccinated. So given that testing is slowing down, will the testing site at the mall remain open indefinitely?
Yeah, I think the plan is to continue to do testing up there. I don't know exactly what CHS's Cuyahoga Health System's plans are, but I know, just knowing them, that if there's still demand, they're gonna make testing available in some form or fashion here in the community.
And for people who are in our community, is it still free to get tested?
It is, thanks to the legislature supporting that. We still have, for anyone that lives, works, or goes to school here in Tompkins County, they're eligible for free testing through the Cuyahoga Health System testing sites.
Fantastic, thank you. A couple more questions for you, Frank.
Sure.
Can you explain why there is such a difference between the COVID death numbers for Tompkins County from the state website and our health department daily table? It seems like there's a big difference. Why is that?
Yeah, and we've tried to rectify this. We've had this question quite a few of these town halls. The challenge is we don't know what the state really considers a COVID death. So we see if someone dies in Tompkins County, the Vital Statistics Office, which handles births and death certificates, is part of the health department, and we're reviewing all of those causes of death and reporting those as we're made aware of them through that process.
Mm-hmm.
There may be other deaths that are either not related, that folks may have died someplace else, but we're a resident of Tompkins County that New York State is aware of. They may be looking at secondary, tertiary, and further down the line, causes or complications listed on the death certificate and including those. So that's really the reason. We've been pretty consistently different throughout by about the same amount, right? So it's really kind of just a percentage difference between us and them. And, at this point, I think we're reporting just over 30 and they're reporting maybe just over 50. So obviously every death is a tragedy, but those numbers are still, we're glad those numbers are as low as they are.
All right, thank you. Either you or Amy, anyone, are there concerns about the fall? Do you have any concerns about the fall? Last fall, with students, returning, we saw a huge spike in cases. We saw a large spike. We're also moving forward with full reopening plans. The governor announced so many things reopening, New York reopening, and also reopening plans for the public schools come next school year. Are colleges requiring vaccinations? Fall spike again? Are we concerned? Are they concerns?
So that's the biggest unknown, and I'm always concerned. But I think as a community, we should we should feel good that numbers are as low as they are, and we expected, just like we saw last summer, that disease numbers would go down in the summertime, and then we did see numbers go up in the fall. I think the difference with this fall is more people are going to be vaccinated. In fact, nobody was vaccinated last fall. Both Ithaca College and Cornell have required vaccination in order to return to campus for the fall. The SUNY schools, which would include Tompkins Community College, have also been given direction by the state that there will be vaccination requirements. I'm not sure yet if that includes under the emergency use authorization, or if that's only if and when full licensure is acquired. But I know the colleges are all, looking at this as something that will be part of returning to campus. So we will likely see disease numbers go up in the fall. I don't want to sugarcoat this too much. It's just the nature of how the disease evolves, and we will likely see numbers go up higher than we're used to seeing them this summer, hopefully, as we progress. But that's to be expected, and really what we'll be hoping is that if people are becoming positive with COVID, their symptoms will not be as bad, hospitalizations will not be as many, and hopefully we can eliminate, if at all possible, deaths, but certainly see those numbers reduced. So we'll be watching it. People should expect that we might see some additional cases, but I don't think it will feel like it did last fall.
Oh, we hope not. We hope it doesn't feel like last fall or even last year. Thanks for that, Frank. We all know people have been, locked in, shut down, and, with summer coming, people are eager to travel and go places and visit. And we're thankful for the, those who are vaccinated and feeling, good about doing that. Today I was up at the airport just talking about airlines returning and flights getting up and going again, and we're thankful for that because it's good for economy and good to have transportation for folks. So what about summer tourism? Are we concerned about people traveling into our community? We know we have the most beautiful community, and so people will be coming here. And are there any current travel restrictions that are still in place?
So domestically, there are not travel restrictions. Internationally, there still are some testing requirements upon arrival and such for folks. But if individuals are moving about the United States, there really are no restrictions, and we would encourage it. We want people to start getting back to normal, particularly those that are fully vaccinated, right? If you're fully vaccinated, you should be able to move about the county, the region, the state, the country, and do things the way that you used to. This is the second question with the word concern in it. And, as the mental health commissioner, I have to also be, thinking about how the impact that the pandemic is having on people's mental and emotional states. And I think let us do the worrying, let the public health folks worry about what's going on. I think we've proven that we'll communicate whatever you need to know as soon as we know it. And you should go about, living life the way that you want to, do it comfortably. Always, you have control over your situation. So if you want to wear a mask, even if you're fully vaccinated, you should feel free to continue wearing a mask. Staying 6 feet away from people, you still have control over that in almost every situation. So, stay 6 feet away from folks if you're concerned that they're not wearing a mask or might not be vaccinated. So there are still things that we can do for ourselves that doesn't take anyone else changing their behavior, that can help protect us as we go forward. So get out there, enjoy the summer, come to Tompkins County, enjoy our beautiful nature and all that we have to offer. And if you're coming and you haven't yet got vaccinated, hopefully you'll stop by one of our sites and get vaccinated while you're here.
Oh, well, thank you for that invitation. I think that's really great that people know they can get vaccinated. But in case people have not been vaccinated and they do come and they don't want to get vaccinated, are there any restrictions? Do they still have to quarantine for a certain number of days? Is that still in place?
Not with domestic travel.
Not with domestic travel.
Yeah, the main thing, if you're unvaccinated, you still should be wearing a mask when in public. You still should be maintaining 6 foot of separation from others. That's really the core of the guidance at this point for those that are unvaccinated.
All right, thanks a lot, Frank. I am actually going to stop talking for a minute and turn this over to Amy, who I know has some additional questions. Amy?
All right, thank you, Leslyn. And Frank, I have more questions for you, so we'll continue on this path. But before we go there, I do want to point out that we're going to talk a little bit about vaccines and what's going on with that. And I just got in from the New York State vaccine tracker that 65.9% of our population has received at least 1 vaccine dose here in Tompkins County, and 73.7% of the 18 plus population has received at least 1 dose. So we're still at the top for counties. I'm not going to go as far as the previous county administrator and say that other counties don't count and that we're number 1, although I will point out that they have a much smaller population than we do. So it's an unfair advantage that county had on us, but we are doing really well. And Frank will talk a little bit more about how we're continuing to do well now that the mass site is not where we're getting people the vaccine quite in the same way. So with that, I'm going to jump to some vaccine questions. Have we reached community immunity at this point, Frank, with that vaccination number that I just shared? And is that still relevant given all of the changing with the variants and the virus? Is it still relevant to be looking for that herd immunity?
So no, we have not reached herd immunity yet. And yes, it's still important. And I think I mentioned this a bit earlier. I often get the response, particularly from folks that might not want to get vaccinated, that, well, if you're vaccinated, why do you care if I am? Well, it's not about the interaction between you and I, a vaccinated and unvaccinated individual. It's about the ability for the disease to spread in our community. And if that ability exists, then the opportunity for the disease to evolve and mutate into other variants is there. And that's what we're trying to stop with herd immunity. Yes, herd immunity also protects all of us by limiting, our ability to be exposed or become sick from a communicable disease. But in this early phase with a novel disease, the purpose of herd immunity is to stop it from spreading so it doesn't continue to evolve and mutate. So yes, it is still very important, especially because of the variants. We want to get ahead of it where we have herd immunity in place before a variant evolves that, like I said before, is either more virulent, more contagious, or is not stopped by the current vaccine. So yes, it's still very important, and it is a goal, and we're going to keep working to achieve it.
Thanks, Frank, for that. And how are the vaccinations going? How are they going in the school districts? Are we seeing uptake in that 12 plus population now that that's come online?
Yeah, we've actually seen really good uptake in the 12 and older population. Again, we were extremely fortunate that Cuyahoga Health System stood up in that first weekend after the vaccine was approved, an opportunity at the mall where almost 800 children were vaccinated. Our local pediatrician, Northeast Pediatrics, got in a shipment of vaccine and immediately opened up hundreds of appointments for children in the community. And we've been working with the local school districts to go out to each of the school districts and provide opportunities right there in the schools, either during the school day or after hours, so children could get vaccinated. In fact, we have a team in Trumansburg as we speak, running a clinic for children up there at the elementary school. So we're going to continue as we have throughout this. We focus on the mass vaccination first, but then we have to take the vaccine out to where people are, and that's going to be our continued path as we move forward.
So a couple of the things you said, I'm going to bring out a little bit more. So with the children, are we going to have any predictions, or do you have any predictions on when vaccines may be available for the under 12 population? And what does that look like?
Sure. Yeah. I've heard a lot of different things, and I always hazard to guess, but generally speaking, it sounds like late this calendar year or early 2022 is what we're looking at. And there's multiple phases, particularly with children when you're developing a vaccine, because you have to figure out the dosage to get the appropriate immune response. Then you have to also look at safety, and then you're also looking at efficacy, right? So all of those things, have to unfold for them, within the child population before the vaccines will be approved. So it might take a little bit longer. I think it's highly unlikely before the fall school year starts that we'll see an expansion, but if they prove me wrong, that would be great news, because that would just mean more folks we could get vaccinated.
So on the vaccine piece, where do people go right now to get vaccinated? What do the local options look like for someone who's searching for vaccine?
Sure. So there's a couple of things. I would always point people to the health department website, because that has all of the pop-up type events are generally there, whether it's us, Cuyahoga Health Systems doing them. Reach Medical has done a few, our local pediatricians. So we're trying to keep information there for folks to see. I'd also point out that most pharmacies have vaccine that you could walk in and get today. So that's a real good choice if you're looking for, it's just to decide today, hey, I'm going to go get vaccinated. Call your local pharmacy, because they'll probably be able to get you vaccinated pretty quickly. So keep an eye on our webpage as we continue to do small pop-ups throughout the county, and also, check out your local pharmacy.
And Frank, what about local doctors' offices? How does that work? Are they going to be providing vaccine?
Yeah, some local doctors' offices do have vaccine. What many of them have found is amongst their populations, those that want to be vaccinated have been. And the vaccine is it's challenging to manage in really small numbers. So for a doctor's office, unless they have a certain number of people that they know are interested, it's hard, because once you puncture a vial, you only have a few hours to use the whole vial. And in the pharmacy world, wasting doses of vaccine is, it's hammered into their thinking that we just don't do that. Although we've shifted a little bit, particularly recently, where we won't turn somebody away for fear of wasting a dose. But for a local physician's office, that means they have to have at least a couple of people that they know want to get a vaccine. And in a lot of instances, they might be having conversations at the moment the individual comes into the office. And so it's a little harder to plan for that. But all that being said, there are some local physicians practices that do have vaccines. So if you're interested, reach out to your healthcare provider if that's who you'd like to get your vaccine from, and they can help guide you through that process, whether they have vaccine or they can direct you someplace that does, or if they get enough interest, then they could get vaccine themselves.
And Frank, I'm going to go off script on the wasting of vaccine doses. That's been a question that has come up. How do we ensure that we're kind of continuing to maximize the doses we have available, and what practices are in place for that?
Sure. So early on, we would not waste a dose. If we used up a vial and one more person showed up, we would turn them away and tell them to come back another day, because we weren't going to open, a vial for 10 doses and only use one out of it. We just would not do that. I would say it was probably about a month ago that the state guidance shifted, that now allows for responsible wastage. And what that means is now we've shifted our thinking, is that we're not going to turn somebody away from being vaccinated out of want to not waste vaccine. So if somebody shows up and it means we have to puncture a new vial to vaccinate them, and nobody else shows up and we have to waste the rest of those doses, then that's what we'll do. We do it responsibly. We still pre-register people. We plan, for some walk-ins and those things to try to minimize that impact on wastage. But at this point, we don't ever want to turn somebody away. And so the process has shifted a little bit.
Thank you. And if someone misses their second dose appointment, what do they need to do?
Yeah, with things winding down at the mall, really their best option is to call their local pharmacy. So there's no more requirement of this is a first dose or this is a second dose in how it's allocated to us. They're all just doses, and we, excuse me, we have to manage those as a vaccine provider. So any provider that has vaccine can give you that second dose. So if you missed your appointment and you're looking for a second dose, give your local pharmacy a call. That's probably going to be your best bet.
All right, this is my last question, but I'm not going to guarantee Leslyn doesn't have more questions for you, Frank, or for you, Lisa. With the mask mandate lifted for those who are vaccinated, how can people feel sure that people who are not vaccinated are complying? And also, why are some businesses still requiring all masks to be worn despite that? So what really is the guidance around masks at this point?
Sure. So vaccinated individuals do not need to wear a mask in really any setting. Unvaccinated folks still do. There's some exceptions to that: healthcare facilities, corrections facilities, mass transit, pre-K through 12 schools, where mask wearing is still required, but almost and pretty much every other setting it is not. The question about how do I know if that person without a mask is vaccinating or not? The honest answer is you don't, and you're never going to. And yes, there's going to be some people that are just not going to wear a mask and not get vaccinated. And yes, there's the potential that they could have COVID and transmit it. But really, all of this is about personal responsibility. We're asking our community to comply with the guidance. If you're vaccinated and you're concerned about the people around you not being vaccinated and not wearing a mask, wear your mask. Continue to stay 6 feet away from them. All of the guidance that was in place previously, you can create for yourself just by changing your behavior if you see something that you're uncomfortable with. So really, let's not worry about what the other person is doing. Let's think about ourselves, how the situation works for us. And certainly every individual is different. If you have an underlying health condition or other situation that makes you worried about encountering an unvaccinated person without a mask, you've got to make some decisions about places that you might go or not go. And each of us has to make those decisions for ourselves.
All right, well, thank you, Frank. I'm going to turn it over to Leslyn to close out our town hall.
Thanks, Frank, and thank you for talking about just personal responsibility. People just making, choices. If people feel comfortable wearing a mask, continue to wear your mask even if you're vaccinated. I really do appreciate hearing that. For many businesses and organizations, and this is a follow-up to the question Amy asked, there are other regulatory bodies that, sort of dictate what you can and can't do in terms of the mask. The CDC says one thing, and let's say OCFS, for example, Office of Children and Family Services, says something different for childcare centers. So what are people to do? Some of the guidance is still confusing and one hasn't caught up with the other. So
yeah. I was talking with our environmental health folks earlier today, and they're frustrated with it too, because everybody's calling asking what do I do? And we're in this kind of conundrum that so much guidance was put out trying to give direction to different industries and different types of settings to try to make it as clear as possible when we had restrictions in place, that now as we're trying to unwind that, it's complicated. The general guidance is if you're vaccinated, you don't have to wear a mask or socially distance unless you're in those 5 or 6 settings. However, any business or organization or the state is, if you look at the CDC guidance, it says you can go without a mask unless there are state, tribal, territorial, or local requirements to wear one.
Mm-hmm.
And that includes for individual businesses. They may decide, maybe they have a staff member that has underlying health conditions, and for them, it's just better for them and their business and protecting their staff that they want everybody to continue wearing a mask. And so you may see a sign in that door that says, please continue to wear your mask while in our business or organization. So they have that right. It is a bit confusing with the different guidances out there. We are, hopeful that those guidance will either get aligned and or some of the older guidance will just go away because we're using this more foundational. If you're vaccinated, you don't have to wear a mask. If you're not, you do. But in the interim, we got to continue to be patient with everyone. We're doing our best to try to advocate for the particular guidance that we think are the most confusing or not aligned. But ultimately, we're not writing that guidance. So, we have to be patient until some of that clarity comes. But really, please use the reasonableness approach. We're just trying to protect folks. We don't want to have the disease spreading. If you're vaccinated, follow the rules of the building or facility that you're going into, because they're just trying to do their best to protect their employees, themselves, and whoever else is in their facility. And for those of us that have chosen not to be vaccinated, understand that there's a lot of folks that really want everyone to be vaccinated. And so if you're not, they're still going to be asking you to do things a little bit differently because we're concerned about the disease spreading in our community.
Thank you. And a couple of other follow-ups, and we had another one that came in the chat as well. So thank you to the community for sharing your questions. So you talked about responsible waste. Is that an indication that there is a vaccine supply? There's a shortage, like when we first started, there wasn't that much and people were scrambling. So we can safely say we have vaccines?
Yes, we have all 3 types of vaccine and more of it than we have arms to put it in Tompkins County.
Well, we still have a lot of arms out there that have not been vaccinated. So we have vaccines. Come get vaccinated. Again, if you're so inclined, you don't have reasons to not do it. We encourage you to. I got mine way back in March, and I think I'm still doing okay. I might have put on a little weight. That's about it. But I don't blame it on the vaccine.
No.
But other than that, I think it felt safe to me. So we encourage you to do that. From the chat, somebody said, I'm sure you heard the news that the Ithaca metro area ranked 5th in the country for vaccination, according to Fast Company. Frank, can you share your thoughts on that? And Lisa, I'll ask you to share your thoughts too.
Well, obviously that's good news because it's reflective of what we're doing. I have to call into question anything that's calling Ithaca a metro area, particularly compared to the other cities that are in the top 5, but we'll take it. We're happy to be recognized. And it really just, it's a thank you to our community, the partnerships that helped get vaccines available with health systems, the school district, our local providers, Reach Medical, everyone has been trying to make vaccine available. And then thank you to our community who's responded as they have through the entire pandemic by stepping up and helping us by, following the public health guidance that we put out, including asking them to get vaccinated. So it's great news. The work's not done, but it's always good to realize that the work is paying off, and hopefully that will continue.
Awesome. It is good news indeed. So I have 2 last questions. And Lisa, I'm going to ask you these 2 questions, but you can feel free to pass on the first one to Amy or Frank if you want to, but you can't pass on the second one. So the first question is sort of a prompt. It said, I'm interested in getting vaccinated, but worried about side effects impacting my ability to work the next day. This is something we've heard. And for our community, it might affect a lot of employees at small businesses who, don't want to miss work. And so they're not getting vaccinated. What are your thoughts on that in terms of protections, labor law protections or employment protections for employees to go get vaccinated? And if there are side effects, what protects them?
Sure. So thanks for that question, Leslyn, and the prompt. In New York State, the Department of Labor, under the Department of Labor, there is the paid leave for COVID vaccines, sick leave that it allows individuals who have gotten vaccine and have a side effect afterward and need time off to be able to use that. And it's just good for people to be made aware of that they can take that time off and be paid for it under New York State Department of Labor.
Well, that's good to know. And hopefully that word can be spread around so people aren't afraid to come get vaccinated because they lose work and not get paid, etc. Well, thank you for that. And then my last question, Lisa, for you. And let me take time to once again introduce to those of you who are joining us and who will watch this later that our new interim county administrator is Lisa Holmes. Lisa served as the deputy county administrator for a number of years now. I can't remember how many years. Prior to that, 3 years. Prior to that, she was the director for the Office of the Aging and deputy director for the house. But she worked with the county for a very long time, and we're incredibly excited to have Lisa be in this position. Amy continues to work with our EOC. Amy, our other deputy county administrator, has done a fantastic job. You've heard all that has happened in Tompkins County. We're ranking number 5 in the country for this, and it's not just by happenstance. It is because of really careful planning and work. So thank you, Amy, and thank you, Lisa, for stepping up in the interim role. So my question for you, Lisa, is what are you hopeful about in terms of COVID in our community, in terms of our economy reopening and revitalization? What are you hopeful for just being in this role as county administrator?
Thank you for that introduction and for that great question. I feel like Frank and Amy got all of the hardball questions and I get the fun one to answer. So I appreciate that. I guess I am very hopeful based on all of the hard work that so many have done over the last several months on the COVID front. Frank, Amy, our other colleagues in the county at the EOC and our partners in the community, Cuba Health Systems, and many others throughout the community have put in such hard work and dedication to get us to where we are now. And so many members of the community have taken it seriously, have used precautions and followed the guidance. So my hope is that we continue to stay healthy and protect one another, respect one another, respect that people may still have fears and anxieties, and that we continue to listen to one another, reach out and help our neighbors, but also that we enjoy ourselves and then this newfound ability that we have to come back together and gather. Leslyn, you'd mentioned the event at the airport. I was also there this afternoon, and we see that more flights are coming in. United has just started reopen service at the airport, and so there's greater opening locally in our airport and our transportation and our economy. So I'm very hopeful about that, and I hope that we all just take the time to celebrate these accomplishments and enjoy our beautiful community and everything that we have to offer here, and that we continue to get vaccinated, that we continue this great trajectory that we're on.
Thank you very much, Lisa, for that. And we look forward, I know this community looks forward to all the good things that, that will come. Amy, I want to shift to you, and I noticed that you all are in a different place. I don't see the long hall and you, Dominic, and Jay and others in the EOC. So what's shifting with the EOC? Tell us a little bit.
Sure. So the Emergency Operations Center has gone virtual which is kind of an interesting thing to say in the pandemic world when everything else went virtual. Our EOC team was together pretty much daily for the last 14, 15 months now. So Leslyn mentioned some of the team members, Frank, obviously, and myself, as well as Dominic Recchio, our communications director, and Jay Franklin, our assessment director, but our planning operations chief for emergencies operations, as well as Jess Burfus from Department of Emergency Response. We all relocated to the Department of Emergency Response and have been together pretty consistently for those several months. And I think that's when we talk about why we're ranked where we are, I think that's a big piece of that. All of those individuals sacrificed a lot to make this happen. We continued to come in day to day and made sure that we protected each other and we respected each other and leaned on each other. We've been quite a team and we continue to still get along. There have been moments, I see Frank laughing as I say it, there have been moments where we've had a lot of stress and pressure and we're talking life and death. And how do we really model this for our community? And so that team has been in person at least 5 days a week. Early on, it was 7 days a week for many long hours trying to figure this all out. And we had guest appearances from the county administrator, from Lisa, from other members of the EOC who would come in either virtually or in person to help us get through all of these challenging questions. And, you know, in some ways, this opening up feels a little like when this all began because there's so many unknowns. And Frank spoke a little bit about that. We don't know what's going to happen next. What we do know is our community responds and acts really well. And we have strong leaders here that are going to continue to guide us through it. We have a lot of infrastructure that we've set in place. We have a legislature and county elected officials that are willing to step in and provide for the community as needed, as we've seen with testing. We have community partners like the hospital who stood up testing facilities, who stood up, you know, vaccination sites in partnership with us. That's something that's different than a lot of other places, not only across the state, but across the country, is we really have a committed group of people. So while we're not in person anymore, I will say my text messages and my team's messaging has not slowed down. It's probably increased a little. I also am finding that because we were still, while our focus was EOC, there were still some meetings that I needed to attend with my deputy county administrator hat on that Frank and Jay would be included in. And now I'm getting messages because they've still got those meetings going on in the background. So it's gonna be different. This is a new challenge for all of us after spending so much time in it, to now go back and continue to manage pandemic and start to manage our other responsibilities. Frank mentioned he's not only the public health director, he also oversees the mental health departments. So coming into the bat, and they're going through some major changes. So things are winding down, but also ramping up for all of us. And at the same time, we know that at a moment's notice, that entire emergency operations center, as well as all of those guest stars that appeared with us, can come back together to respond to whatever comes ahead. And, you know, for me personally, I'm very fortunate to have all of those people that I mentioned really there for us, and all of us are in the community. It's been a long haul. We're not through it yet. We're still in the middle of a pandemic, but we're starting to really see where that light at the end of the tunnel is.
Thank you, Amy. And, you know, on behalf of the entire legislature and this entire county, all our residents, we do want to thank all of you for the time you put in pulling together what I consider a gold, maybe platinum standard blueprint for how we respond and now how we recover and how we maintain. Because like you said, we're not done yet. We still have to maintain what we have, you know, responded to and put nicely in place. It has kept us safe, and we have to continue in our recovery. So there's still work being done. And I do want to thank you and all of the staff who also stepped out of their normal roles to chip in and do, whether it's communication or just helping in whatever way. And all of our legislators, as you said, as well, our community in general. I'm going to wrap this up because I know we're a little past our time, so thank you for hanging in. The last time we did this, we also had with us our former county administrator, Jason Molino. And I want to take time right now at this town hall to thank Jason. He's left us, and we certainly respect his decision, but he certainly has helped to put in place or pull together a great working team with all of you and a lot of our senior leadership staff within the organization, thinking strategically, thinking long-term about how we keep our community top-notch, how we keep it safe, and how we keep it as one of the communities that people look to as a leader and a model in our country. So thanks to Jason, and best wishes to him from all of us and from everyone who has joined us over the months and on this call. I also want to end, thank you, Lisa, for talking about respect and celebration. I also want to end by acknowledging that last Tuesday, at Tuesday's meeting, our legislature proclaimed for Tompkins County, and that this is Pride Month, and we encourage all of our citizens to celebrate and honor the members of our LGBTQ plus community who have been giving so much and contributing so much to the growth of our community and to our world in general. And we also proclaimed, because this is the month of June, that we celebrate the Juneteenth, which is described as the final emancipation of people who were enslaved some 2.5 years past the Emancipation Proclamation, but we're glad that it happened. And we encourage folks to stay tuned to the events that are happening for Juneteenth. I want to highlight and amplify the June 19th sort of annual, we didn't do it in 2020, but annual Juneteenth event that's hosted by the Southside Community Center, and encourage people to stay tuned for more information and participate. Thank you all for joining us. Continue to enjoy the summer, and we'll see you when we